lecture will commence in the order of the introduction of the Korea Disease Control and Prevention Agency, KDCA, and the disinfection system of Korea in regards to the COVID-19, and lastly, how the treatment and maintenance for those who are infected with COVID-19 are going. The organization of KDCA is a vice-ministerial government organization with 5 branches, 3 agencies, 41 departments, 13 quarantine stations, and 11 substations. The epidemiological investigation consists of the Central Epidemiological Investigation Team from the central government and countries and cities. Each team from the countries and cities, the Metropolitan Council, and the central government is regulated to conduct their work according to the size of the occurrence. Especially, from April 1st, we have been executing 14-day quarantine for all the entrants to Korea. Any entrants with symptoms are supposed to execute the inspection right away, and if they test positive, they will be directly transferred to hospitals or life treatment centers to receive appropriate treatment. And for those who have been tested negative, they will still be conducting 14 days of obligatory self-quarantine. Anyone without symptoms is also required to conduct 14 days of quarantine. All the expenses for the inspection and treatment are supported by the Korean government. However, no expenses are supported to the locals. Now, here's how we discover the chronics in early stages. First, the operation of the specimens collected. At the specimens collected, we increase the accessibility of the diagnosis so that many people can be tested in a short period of time. Those who show a specific symptom, such as cough or fever, will be directed straight to this center before accessing any medical organization. As you can see here, there is a drive-through, specimens collected that can be accessed through cars. And here's a walking through, specimens collected that can be accessed on foot. Currently, a total of 118 selective care centers are operating across the country. Here, around 20,000 people can be tested in one day. As mentioned before, epidemiological investigation is promptly conducted by the central and local governments so that the source of infection can be traced and the contact makers could be quarantined safely. Through the process of interview, they identify the places that infectees have visited, and sometimes they also conduct additional interviews with the medical team and infectees' family members. About the epidemiological investigation, we also operate a system called the Epidemiological Survey Support System. Through the system, we identify the location of the chronic through their mobile phone and also track the transaction details of their Metro card and credit card to correspond to the situation more promptly. This way, those who have visited the same place as the chronic would also be classified as contact makers, and they will be investigated by the KDCA. This is how the system is operated nationally. Once the infectees are identified this way, the ones who are confirmed to be infected with infectious disease pathogens according to the inspection standard, regardless of the paroxysmal event. If they are tested positive, they will be identified as a confirmed case and receive appropriate treatments from medical organizations or life treatment centers. Now, a brief description of the treatment and support for the confirmed patients. Those who have tested positive will be managed by the state. They will be going through a medical support service or symptom monitoring from the Life Treatment Center or other medical organizations. And the infectees will be classified into levels of severity, such as minor, serious, or profound, and receive the appropriate treatment. As you can see, the patients with severe and profound symptoms will be assigned to hospitals specialized for infectious diseases or hospital treatment centers designated by the state to receive prompt treatment. Also, around 90% of minor subclinical patients will be quarantined to the Life Treatment Center and receive monitoring measures. This is a picture to show the process of classifying the severity of patients and designating them to each medical organization. Later on, the infectees will be released from quarantine like so. The standard of the release depends on the satisfactory clinical course or inspection result, especially when you are tested negative. In this case, if you are tested negative in 2 consecutive tests conducted 24 hours apart, you will be released. This way, you can go back to your ordinary life without the quarantine process. In my opinion, there are 3 major achievements in terms of this successful K-quarantine. The first would be how the Korean citizens actively cooperated with the government's measures compared to other countries. There are many cases of other countries where they have failed to successfully manage the epidemic curve of COVID-19 even under the complete blockade, whereas in Korea, the citizens have coped with social distancing, washing hands frequently, and wearing masks at all times without a complete blockade. In this sense, I could say that Korean citizens have mature civic awareness. The second would be the devotional activities of Korea's medical team. In Korea, all COVID-19 patients are receiving quarantined hospitalized treatments at medical centers or life treatment centers. All of the medical teams from doctors to nurses have dedicated their life to treat the chronics. Their dedication has contributed to far fewer deaths compared to other countries. That is why I consider the dedicated medical team to be the second achievement. The third would be innovation. The first innovation would be the establishment of a large-scale definite diagnosis system in a shorter period compared to other countries. Government, medical organizations, and companies that develop and produce the diagnostic reagent became the trinity to operate this diagnosis system and successfully enabled the system to diagnose over 20,000 people in just one day. This would be the first innovation. The second innovation would be the operation of an epidemiological survey support system. By establishing a system to identify contact makers in the early stage by tracking the mobile phone, credit card, and MetroCard history of the infectee, the large-scale identification of contact makers and quarantining them in early stage were enabled. This way, we could block the source of infection in an early stage. This was the second innovation in my opinion. The last innovation would be introducing the drive-through and walking-through methods so that more people could be inspected in a short amount of time. I feel like these 3 innovations, which are the diagnosis, the epidemiological survey support system, and driving through and walking diagnosis method that enables a large number of tests in a shorter period, were the biggest achievements in corresponding to the COVID-19. These achievements are what has resulted in the K-quarantine today. and this K-quarantine has enabled Korea to result in fewer deaths and chronics compared to other countries. These are the characteristics of the K-quarantine of Korea, corresponding to COVID-19.